welcome to the Inner Circle Boardroom's Backstage Pass. If this is your first time here, a very big and warm welcome to you. My name's Kay Chohan. This is the platform you'll find me in discussion with investors and boards. I'll be unpacking their views to business turnarounds and how to scale a business. I'll also be bringing you the latest thinking into some of the market gaps and opportunities, as well as investment strategies. Today, I'm speaking with Simon Harrison. He's a well-respected M&A and change management expert within the healthcare sector. Not only is Simon an advisor to Grant Thornton, but he's also on the turnaround panel for PwC. He also acts as chairman and non-exec and has worked for some prestigious brands. Simon, welcome. Really pleased to have you here in a conversation with me today. I'm hoping you'll help us understand some of the gaps and opportunities you see within the healthcare sector. We also know that the global healthcare spend is expected to rise. So I would like to uncover here today what some of those impact and implications will be for investors, operators, and the consumers. Let's talk about operating models to start off with. So how are existing operating models being impacted and some of the shifts as a result of the pandemic?
Yeah, it's interesting because, clearly, if you're running a social care business, it's not high tech. It's very much about people. And people are affected during the pandemic. So I always say, you look at three things. You look at quality. If you haven't got the quality, you haven't got a business. You need to look at the staff you engage with, so the recruitment and retention of your staff. And then following on from that is your revenue, which is your business line. So what's been impacted significantly this year is the impact of the pandemic on the people you employ and also the people you look after. And certainly when you're trying to manage revenue, if that's from private income or it's from local authority income, the whole pandemic has affected the way people work. And so cash flow has been significantly affected due to the speed at which people have been either able to work or have been impacted about their ability to actually get the deal done.
There's a lot to unpack there. What would you say are the fundamental changes that are going to be required in order for operators to survive and thrive coming out of this?
I think it's about being confident in your product. I go back to the point about quality. You've got to have something that people want to buy. So even though we're talking about care, it is still a product. And there's lots of choices that people can make. So therefore, when you're providing care, it has to be the best. You have to be providing something that is a unique selling point. You've got to have a USP like any business. Why choose this care home? Why choose this environment as opposed to another? And it's got to be something about it. It's got to be, generally speaking, the people or the environment or the reputation. And it's important to put yourself into that position of saying, would I want to stay here? It's like going to a hotel, isn't it? You can recommend somewhere, but would you stay in a hotel where you didn't have the facilities that you wanted? We've all got used to nice things in life. And so therefore it's got to be something that you would want to stay in. Therefore you want your loved one to stay in as well. But the changes are around how people respond to getting that right. I call it the ABC, the right attitude, the right behavior and the right culture. And that goes right through an organization. It goes through an organization for the people providing the care and the service, and it goes to the boardroom. Is the boardroom, do you have the right attitude in the boardroom? Do you have the right behaviors been exhibited and do you have the right culture? Because if you've not got quality at the center of your boardroom, it's very hard to tell someone to have quality at the centre of what they do in an environment that's providing care.
It's a really interesting point that you've just highlighted there about the quality of the care homes and the quality of service. I was chairing a board discussion with a number of business leaders, and we were looking at how traditional care homes haven't actually, some of them are not really set up in a way that is of high quality standard. We were looking at how care homes might change coming out of this as well.
Absolutely.
Right? How does that then start changing the dynamics of floor plans in terms of how care homes are laid out?
Absolutely. Essentially, simply speaking, in this country, we have two tiers of care homes. We have the luxury self-pay, the new builds, And we've got a massive gulf between that and a budget care home, which is local authority funded. And then there's a whole range of generations in there. So there's a lot of care homes that are still trading that were at one time had another use. They've been converted and they provide a safe environment. They provide a very homely environment, but they're not fit for purpose going forwards. And in fact, during the current pandemic, I've had incredible difficulties in being able to provide a separate area for people to isolate and a big area, a big space for people to come together, but safely, and an area where relatives can come and visit, again, safely. So the new care homes that are being built, and there's quite a few of them being built now, and I'm sure going forward into the future, real estate will have a look at how the optimum look of a care home would be. And I've not had the privilege of going, but I know some people who've taken the opportunity to visit, care homes in North America or in Europe, where already we've started to learn some of the things that we can do better. Now, the downside of that is the cost of land in this country. So you buy a piece of land, you can buy a piece of land and you can build up like we all do for houses. What you ideally want to do is to build out, but that means you need more land and therefore there's a greater cost and you need to recoup that cost through your fees. But the optimum would be a care home that isn't on multiple floors and has a lot of space, both internally and externally. And that would certainly make life easier going through a pandemic.
I want to sort of understand and unpack is how would have COVID impacted the cost base of care homes, and what does that do to profitability of the sector in the face of high debt leverages in many companies?
I mean, the cost base has been severely impacted by the purchase of PPE, so the masks, the gowns, all the things, the hand washing, all of that. Now, the government have provided funding for that. But in the early stages, certainly care homes themselves were bankrolling that and were certainly having to buy in bulk, which they wouldn't normally do, so that they had sufficient supplies to make sure that all their staff were safe and all their residents were safe. Over time, the infection control funds have become available, PPE funds have become available from the government. The downside, of course, is the government make it quite difficult. So the money goes to the local authority, then you have to put an application into the local authority. It's not just as simple as saying, I've got a 40-bedded home, give me 40 times whatever the amount is. It's a lot of form filling. You don't always have the same funder for each one. So all of that becomes very complicated and itself becomes a cottage industry. Nevertheless, the cost of providing care has gone up insofar as what is required at home level. The other thing that's gone up is the cost of providing staffing, because it's been really difficult when you've had absence of staff to be able to cover those staff to provide safe care. And even in the last weeks, the government, Department of Health, have made some new announcements about agency staff. And agency staff shouldn't be working in more than one home. Well, the whole raison d'etre for agency staff is that they do cover more than one location. So to say to someone you can only work in one home makes it more difficult. And in some cases, actually put the cost base up, because the only way to safely do it is to block book agency, which you might not need. And agency is a more expensive resource. But at the end of the day, you've got to provide the right level of staffing for your home.
Is it a sustainable business model?
I think social care in this country needs a dramatic overhaul. I mean, politically, it needs a cross-party policy on social care. At the higher end, at the luxury end, the self-pay end, I think we've got some great examples of care homes. But at the local authority-funded end, I think we've got some examples where there are some parts of the country where local authorities basically are not behaving appropriately. The reality is you couldn't stay in a budget hotel room only for what we're paid in some care homes per week to provide 24-hour care, food, heating, lighting and environment activities and the regulator, the CQC, still expect the same level of support in a high end as a low end funded home. And why wouldn't we? We should be expecting the same. Those people don't deserve any less And yet the reality is there's more money to play with in some homes than there are in others.
Are you still seeing appetite?
Yes, absolutely. There is still a significant appetite, and the reason being is you've got bricks and mortar. You've got a business that runs. It's a people business that runs out of a facility, and let's not forget that facility has a value. Now, clearly, it needs investment. It needs cash flow. It needs working capital. But it is an investment in bricks and mortar that in the future will hopefully hold, if not improve its value. So when you're looking at entrance into a market, you buy in something that has a real estate. And in terms of an exit, there's always going to be a multiple on the cost of a business. The important thing is to make sure that that business, that entity is well maintained and developed over the years. Where some people have failed is they haven't continued to bring their facility into the 21st century. Now, the use of technology is something that a lot of people are getting ahead on now. And that is great because there are some great opportunities to use new technologies to even bring some of the older facilities into the 21st century and make the environment much more fit for purpose. Now, I've heard some great examples recently, even in some homes that have not had a great deal of investment, but the use of technology, particularly through COVID, for communication, for entertainment. Clearly, people can't go out, visitors can't come in, but there are so many technologies now available, so many modes. I mean, we're using one now that people can use in a care setting that makes life just that bit more enjoyable. I think some of the challenges going forward will be around how they can have a structured, systematic improvement going forward. And I think some of the leadership challenges will be there needs to be some planning around how there's organisational development, because I think some managers, certainly at the grassroots level, will probably feel burnt out. Ordinarily, they will have had a level of support from others in their business, but because of the restrictions of visiting, a lot of their support has been either by phone or by using a computer. It'd just be nice for some managers, I think, to have an opportunity to download, to offload all their issues, to have a rest, to feel as though they are supported, and that their regional team and their operational team and their board actually appreciate what they've actually managed through during a really difficult time. We talked quite openly in the media around the NHS and how everyone was going out clapping for the NHS. Then it became social care, and then we stopped. There were all sorts of reasons why we stopped, but I think people in social care have definitely been recognised through the pandemic, and so that's been a positive. I think equally a lot of them will feel quite overwhelmed and quite burnt out at the end of this. And it needs a period of stabilisation and some kind of workforce planning, some kind of organisational development where people feel, do you know what, we're recognised for what we've done, we're getting a thank you, but also it's about making sure that someone's proverbially putting out their arms around the organisation to make sure that it's stable for the future.
How do you think the government and regulators' relationship with care homes will change?
The regulator, the relationship has changed insofar as they haven't opened and been going into homes. So a lot of the regulatory activity has been done virtually. So that's a positive insofar as services haven't had the burden of external visitors. Going forwards, the CQC certainly are saying that it's going to be a risk-based assessment, which again is positive. Where it's affected businesses, and it's certainly affected a number of care homes that have not been rated good, so the good and outstandings have been fine, but where they've been rated requires improvement or inadequate. Even if they have made improvements, because they've not had an inspection, they've not been able to move their rating upwards. So from a business point of view, that might have meant during the pandemic that they've not been able to take new admissions. So from a P&L perspective, if they've had deaths, then obviously their occupancy's only been going one way. So that's been a real struggle. they want an inspection. They want the regulator to come in. They want them to recognise the improvements they've made. They want to get their rating up. They want to get the local authority admitting people again because it's a business impact. And I think that's something that some providers have found really difficult. So that, the government and the regulators need to, if you like, pull their finger out when we get out of this. And those people who are overdue an inspection need that visit. The public need the visit for a reassurance that it has improved, but the business need the inspection because they need to move out of that difficult period into a future that is about growth and strategic development.
That's a really interesting point you make there, particularly if you might be looking for an exit as well, or looking to raise capital, and that might impact things like valuation.
Well, I can give you some real examples. I've been working on it's been an administration through the lockdown, and one of the difficulties purchasers have had is actually getting in with their valuers to get a valuation of the property and the business to be able to buy it. And so a lot of it has been done virtually, and we've managed to achieve quite a lot, remarkably, because it's a new way of working. But it's not an ideal way of working. I mean, certainly personally speaking, when I'm chairing a business, I like to get out and about. I don't just like to sit in the boardroom. And actually going forwards, it'd be quite nice to meet people as opposed to doing everything on an IT platform. But the reality of life is that's how we've had to change and adapt. But going forwards, nothing can actually beat going into a service, actually having a look and a feel about it, and meeting real people, and reassuring yourself that they're doing a good job, and reassuring them that they're doing a good job, and actually showing a level of interest. So I think everyone struggles. So the real estate people have struggled in terms of marketing businesses. Investors have struggled in terms of moving into the sector. And I know a number of people who are thinking, should we or shouldn't we? And they've just kind of parked it until the new year, because even though they probably could get a deal done, it will take so much longer. The lawyers will take so much longer, just because everything is much slower. And the risk of not getting the deal that you really want is probably worth waiting a little bit longer, because there's such a level of uncertainty. Certainly, we've sold a number of care homes through this period, but it's been a more protracted process than perhaps it would otherwise have been. And, people want that reassurance of being able to go in, have a look, what am I buying here? Let's meet the manager, let's meet the staff, let's look at the environment. Now let's go and raise the funds. Let's reassure the bank or the lender that this is a good business. Here's the business plan, and here's some pictures of the facility, and our valuers had a look and they're all good with it, as opposed to everything being virtual. Now, whilst that can still make a deal happen, it is much more protracted.
And I just want to talk about banks lending going into that sector. What are you seeing? Because some of the conversations I've had is about banks they're being a lot more cautious. What sort of things are you seeing on that front?
I think it does vary, because actually there are a few of the main traditional banks, let's say, who've got portfolios in care, who are probably shying away from it going forwards and probably want to exit. Having said that, there are a number of lenders, and certainly some of the challenger banks are definitely looking to lend into the sector. I think there are banks who are certainly prepared to lend into the sector, and there are alternative sources of funding as well. So it is an exciting sector to be in, albeit challenging. It's definitely an exciting sector to be in.
For those that don't know that sector so well, what's the average sort of margin we're talking for a care home?
It depends. I'm not avoiding the question. It really depends on the subsector that you're in. Are you a nursing home? Are you a residential home? Are you local authority funded? Are you privately funded? Are you a specialist dementia unit? Are you looking after people with challenging behaviour? All of those carry so many different differentials.
So if you were investing right now, out of all of those, and you had to prioritise which one you wanted to invest in, where would you go? Because you know that you're going to have good...
I would be moving towards a higher end acuity of challenging behaviour, because that is it's a more specialist subsector. Obviously, fees are better, but it's a sector where the market is less densely populated, whereas there are a lot of care home providers. There are a lot of good care home providers, but there are a lot of care home providers, and therefore, in some streets there are a number of homes, and it's been able to single something out that is slightly different, that picks you out from the rest.
How is the sector impacted by STP and the ICS strategy to deliver more care at homes?
It's a good point. I mean, certainly in terms of the drive from policy is around supported living and domiciliary care. So, I can give a real example. I've got a friend who sadly has a partner who is being cared for at home, and it's expensive, but it is what the drive would be, is not to put people into institutional stroke residential care unless it's absolutely required. But there is a tipping point. There's a tipping point as to when that care becomes full-time and actually then switches from being supporting someone in their own environment to actually they will be better in a purpose-built environment with that care package around them. But in an ideal world, people would have a package of care around their needs in their own environment. And certainly there's a lot of supported living providers who are doing incredibly well by providing something that is bespoke, something that is specific. Care homes clearly have a solid foundation in our society, but they provide a level of care that centres around the individual, but within a framework, because clearly there's a set of bricks and mortar and front door and back door, whereas people's individual homes are all very different, and people are familiar with their own environment, and therefore if they don't need full-time care, then providing a package of care around their individual needs gives them a significantly better level of independence within the community in which they live. And it's about getting people to understand that, and all too often it needs to be picked up at the earliest stage where someone needs care, whether it's because they have a learning disability or because they're elderly and becoming frail. And it's about, at the earliest stage, starting to pick up the pieces and put in the framework around the individual to make sure that what they get is what they need to have the best possible quality of life in the community in which they live.
We know that immigration is the backbone of many businesses, including the healthcare system. How do these healthcare sectors moving forward continue to attract significant numbers of motivated staff, particularly with the Brexit scenario?
Yeah, it is going to be an issue, certainly for nurses. So on nursing, for many years we've relied on nurses coming from different countries. We compete with the NHS. So the NHS recruit nurses, they train nurses. The independent sector recruit nurses, and in some cases now are training nurses. But we've often relied on bringing overseas nurses in, and clearly Brexit has an impact on that. Although the actual detail of it still needs to be finalised. But in terms of carers, we often say we compete with our competitor care home, or we compete with the NHS. In reality, on carers, we're often competing with supermarkets. And that might sound a strange thing to say, but oldie, little, growing like nothing really. And the people who are looking to enter that level of paid work might look across a number of opportunities, and we'd love to see people move into care, but it has to be something that people want to do. You wouldn't be doing it for the money, you'd be doing it for the money, and it's because you want to do something different, you want to provide a level of care. And in some geographies in this country, we do struggle to recruit staff. And Brexit will have an impact because, you know, in some parts of the country, we do have quite a heavy overseas workforce, whereas in other parts of the country, we don't. And it is very, very geography dictated.
How do you continue to attract people to that sector? You're competing with the Lidls. Would you say those people could easily be qualified to provide care?
Well, most people provide a strong level of induction and then a strong level of staff development. The important thing, one of the key market challenges for social care now is staff retention and turnover. You know, we often,
which itself is an issue.
It is, and you know, we often largely paying at or just above the national living wage. So we've got to do something to make sure that, you know, not least of which Brexit, but also competitor businesses trying to recruit staff, and then coronavirus, you know, clearly has an impact. You know, it is a risk. Thinking about recruitment into care homes, and you know, some services do really well. They have a reputation. They build that up because, you know, family members have worked there in the past, whether in the kitchen or in the laundry or in care. But other services struggle more, maybe because there are a number of homes in that geography, maybe because it is so remote and people actually don't know anything about it. So it's very much around bringing in a way of building your reputation. The manager has a great part to play there in, you know, being receptive to people coming and working. But it's an ongoing challenge. It's something that we challenge all of our managers to recruit, but importantly, retain staff. You know, we look at turnover. Turnover is quite high in the sector. But what's interesting is I've looked in a business recently. The turnover in the first 6 months is quite high. In the first 3 months, it's even higher. But once people get beyond that initial stage, they stay for quite some time. So it's very interesting. I think sometimes it's about people realizing care isn't for them. And the flip side of it is those people who've been there for quite some time realizing that care certainly is for them. And, you know, having really good induction programs, having really good recruitment and retention, having really good ways of mentoring and supporting your staff. But it's a tough business to work in. So some people may not go into it fully with their eyes open and feel it's not for them. Other people have, you know, made a fantastic career out of it and wouldn't dream of doing anything else.
What are some of the common failings and alert signals do you see that result in assets or portfolios becoming distressed? So what are the key signals to look for?
Clearly, if quality is off, so if the regulator is finding issues, and I always say I don't like surprises apart from at Christmas. So, you know, you've got to have your own internal KPIs. You've got to have your operational team managing the performance of your services. You probably need a separate quality program internally so that you've got an independent view as to how things are progressing, so that if a regulator comes in, they don't give you any surprises. They only tell you what you already know. Get your quality right. Then the next important thing is having the manager right. So, you know, we can sit in the boardroom, we can look at KPIs, and we can look at a set of accounts, and we can figure out which services are doing well or not. But the manager in the home is fundamental to recruiting and retaining the right staff. If you've got your staffing model right, then you can spend some time looking at your P&L. You can look at your revenue, you can look at your occupancy, you can look at your fee structure, you can look at your cash flow. So there's a number of KPIs that I would be looking at. They will be around quality, they'll be around staff turnover, they'll be around the use of agency, and then they'll be around occupancy, revenues, and then it'll be around cash flow and cash collection. And a lot of it is around getting your systems and processes right, making sure it's as simple and error-free as possible, so there's less likely to be any glitches on the way.
You spoke about cash flow and credit control. With the pandemic and a lot of people being impacted in terms of being furloughed, and they're being supported by government and partly family as well, contributions. Is that causing some issues there, some of these care homes?
Well, certainly in terms of cash flow, it is. I mean, I think one of the things that the government have done is said there's a lot of money available to the care sector, but it's gone from central government to local government. Local government have, in some cases, made it quite difficult for care homes to receive their monies, and therefore the care homes themselves, generally speaking, have had to put additional resource in to chase the money that is due to them. Certainly, the other thing is in terms of billing. So most people working from home, most care home operators have a centralised finance system, but most people are working from home. Now, generally speaking, where people have got their systems and processes working well, then the billing infrastructure still works as it does normally. When people are in the office, it still works from home. Local authorities, on the other hand, in some instances haven't been quite as agile, and there's been a delay in paying. And certainly I can think of examples where people have actually taken on additional credit control resource to chase down money that is owed to them from local authorities, which in itself, has a cycle. So if you haven't got the cash coming in, you've got payroll at the end of the month, you've got to find a mechanism of paying payroll. That's the last thing you'd want to delay. So therefore, you've got to chase down the cash that's owed to you. If you don't get that, you've got to find a mechanism of borrowing that money until it comes in. And that, we talked earlier about distress. If that happens all the time, that can easily make an organisation distressed. If you haven't got visibility on your cash flow, again, come into a period where you've got a pinch, you've got suppliers to pay, or you've got your staff to pay, you need to make sure that you've got visibility on your cash throughout the month.
There's a lot of businesses out there that didn't have a safe reserve to see them through something like a pandemic.
I'm sure that's the case. And in ordinarily, care sector, has a high turnover of funds. You look after a number of people, you have a high revenue flow coming in, but clearly the other side of that is you have a high cash outflow, whether that be to your staff or your suppliers.
Simon, you sit on the panel for PwC's turnaround, and you've done a lot of restructuring programs. What's the key success to a restructuring program, particularly during something like a global pandemic of this sort?
Yeah, I talked earlier about getting the right attitude, behaviour, and culture in an organisation. The other thing that I would always say is you've got to make sure that right at the outset you engage with all the key stakeholders, both internally and externally. You get a level of honesty and transparency. The other thing then you need to do is analyse the situation and make sure that you absolutely fundamentally understand what's going on, and then manage your way out of that. And when I say manage your way out of it, that makes it sound very easy. But it's about making sure that you communicate extensively, both internally and externally, with all the stakeholders, with a level of honesty and transparency about what can be done and what can't be done. Sometimes things are broken and they can't be fixed, and sometimes it might be better to end it there. Otherwise, it's a case of saying, well, what is a turnaround? Well, it's around, making sure that you get a number of things right. So looking at whether or not there's an opportunity to restructure, making sure that you've got the right advice, making sure that you're managing all your stakeholders properly, looking at all your options, looking at what the risks of those options are, and making sure that throughout everything is documented clearly. So you can always go back and say, we said we were going to do this and we all agreed. Something else has come up. We need to just stop for a second and see whether or not we want to carry on this trajectory, or whether or not we need to look at something else. I mean, essentially turnaround is around, sorting out your financial structure and a systematic improvement in your process. It might be around leadership. It might be around, some kind of strategic development, but it centres generally around making sure that you've got a level of viability going forwards, with the level of support from everyone involved, both internally and externally.
Leaders watching this will have some sort of change management experience. However, no one's really experienced a global pandemic of this sort. What management issues could this highlight and expose that investors need to be addressing?
I don't think any of us were prepared for the level of distress that we would have headed into this year. I mean, if we were all sat here this time last year heading into Christmas, I don't think any of us would have looked at 2020 and predicted what it was going to be like. And looking back now, we've all learned a lot. I think businesses that were in good shape before are probably still in good shape now, although that have taken a bit of a battering. Those that weren't in a good shape before will have probably significantly struggled. And I can see some people next year who've struggled this year and got by because there has been a lot of support and help around. And generally speaking, institutions have been quite forgiving because of the pandemic. I think as we get through next year and we start to move out of it, hopefully, I think anyone who's had difficulties will have to face up to those difficulties. So I can imagine there'll be a number of businesses who are distressed who will next year have to seek help.
How should investors and operators start thinking about their long-term strategy in order to mitigate risk?
I think it's always about making sure that your business is stable. We've talked about cash flow, we've talked about management accounts, we've talked about business plans, we've talked about financial compliance, and making sure that there is a level of quality in the business, that the product is still fit for purpose, fit for market, and that you've got the right people. Certainly during the course of this year, people will certainly have felt battered and bruised. And coming out into next year, I think there will be quite a bit of change, because I think there'll be people who feel as though 2020 has taken its toll on them. 2021, people are looking ahead to a brighter future, but I think some people may be in need of a change or a rest, because I think it's been quite a challenging year for some people, more than people actually understand.
What are some of the other technology advancements that are needed to assist in delivering care? Where do you still see some of the gaps that still require potential solutions?
I think we do a lot of things in a way we've always done it. And I think the use of new technologies to certainly new financial systems, new reporting systems, new KPI systems, ways of documenting care to make sure that A, it's of the right quality, but B, it's less time consuming and certainly less paper reliant. And all of that takes time to put in new systems and processes, and it takes money and investment. And certainly where people are at the beginning of their journey, I always say to investors, you should look at putting some money aside for IT at the early stages, because on the journey, it'll be well worth the investment. If you're at the end of that journey and you're looking for an exit, it's highly unlikely you will be putting an investment in now, because you're not going to get the payback. But the reality of the use of technology over time certainly will make that business more efficient, and certainly more effective, and certainly give it a stronger potential value at exit.
We've spoken about Zoom and having that connectivity, but is there any other advancements around the technology piece that you think businesses should be thinking about?
But I think clearly people using technology to visit services. Families have not been able to see their loved ones. The demand for use of whether it be tablets or laptops or phones, the internet, all those kind of things, we need to make sure that's all available. The last thing we want is that failing at a time when it's critical. And we have something as simple as a telephone. You have one phone that you can answer at a time for one person, but the reality is everyone in that service might want to pretty much speak at the same time. So it's about making sure that we have the right technologies available to us going forwards. and also things that help people to engage with the outside world whilst not being able to move into the outside world. We've all found that challenging ourselves, and yet we do have a level of freedom and liberty that you don't always have if you're in a facility.
What market trends do you anticipate we'll see in the coming year?
I think there's going to be quite a lot of mergers and acquisitions. I think there's a lot of people who are stalling. They wanted to be on the blocks this year, but they've stalled because of the pandemic. But next year they want to move on. I think those people who are distressed may still find that they want to exit. I also think that the care sector is quite fragmented. So, albeit there are some big players, the tail goes on forever. There are lots and lots of small players, and some people are growing and have got an appetite for growth, and others may be thinking, I've had enough now. So I think there's still going to be a lot of opportunities going forwards, and I think that's a good thing. And I think it's also a good thing, and certainly people who are looking to move into the sector, the consolidation that can happen. There's a lot of synergies, a lot of efficiencies that can be made from growing a number of businesses and putting them together. Not least of which will be the head office count, and I can see opportunities for that to take place over the forthcoming years, which could be a significant benefit.
If you were to be looking further afield, which developing markets would you be investing in right now, looking further afield?
I think there's a lot of opportunity. Generally speaking, we're all getting older. People are living longer. People recognise the need to provide the right next generation stock of real estate for people. We talked about supported living being something that is definitely a growth market. Another growth market are retirement villages, which is something that in this country we are now starting to develop, but they have been developed for some years in other countries, particularly in North America. And I think that's definitely an opportunity for growth in this country. It's a mixture of real estate and care, and I think that's quite an exciting future.
Simon, thank you so much for joining me for our conversation today. Guys, I hope you enjoyed the conversation myself and Simon just had lots of valuable insights there in terms of what's going on with the market, some future trends, and just in general, Simon's thoughts on restructuring. If you've enjoyed this, please don't forget to like, share and subscribe. More conversations like this. Also participate by commenting below your thoughts and views on the state of the care homes and the housing sector as well. Also let us know what topics or questions you have in mind and which other business leaders you would like to most hear from, and we'll be sure to get them on board. Simon, thank you very much. How can somebody connect with you if they would like to reach out?
I can be contacted at Ideas Afresh Limited. So it's simon@ideasafresh.co.uk.
Brilliant. Thank you very much. And we'll see you soon, guys.